您好，吴德先生。那非常高兴您今天能够接受我们的采访。那我知道您之前是读了很多的学位，比如说像心理学、生物学，那还是生物物理学的博士。那为什么您会选择试管婴儿这个专业呢？
You know, I think I was very lucky as a child to have such wonderful parents. They were both highly intelligent. And so I was able to do almost everything. I had very little difficulty in school with any subject. And so I feel like everything was possible. But I'm so happy that as I got older, I realized that I wanted to do something to help people. I wanted to make the world a better place by helping create babies, by helping babies be in families that really wanted them. And so I'm so thrilled that I did this. I looked at many other things, but nothing else that I considered doing would have had the kind of positive impact that it makes to help a baby be born, to make families, to have families that can take care of those children and give them a chance to be everything they can be.
能不能给我们大家简单的介绍一下什么是试管婴儿？要什么样的人他要接受试管婴儿的服务呢？
Well, you know, to do IVF actually takes something like 6 weeks, 6 to 7 weeks. But 4 of those weeks are pre-treatment. And then for about 10 days, 12 days, the woman takes medication. She takes shots each day that cause her to make mini follicles, that cause her to make mini eggs. And then when the eggs are mature, we give her another shot. And that shot causes those eggs to become completely mature and be ready to come out. And then we give them some anesthesia so there's no discomfort at all, and we pass the needle directly into the ovary, into the follicle. That's the fluid collection around the egg. And then we apply suction so the fluid with the egg in it comes back out into a test tube. The embryologist tells us whether or not there are eggs. And then the egg is fertilized. The sperm is placed with the egg, and we grow those embryos out for 5 days. We then take a few cells from each embryo and test them genetically, so we know whether or not the embryo is normal genetically. Now, in terms of Chinese patients, all pre-treatment is done in China, and so they only need to be in the United States for about 14 to 16 days in order to do their cycle and get their eggs.
中国的技术，试管技术，它其实现在是飞速发展的。那为什么有很多的中国的客户，他依然会到美国来做试管婴儿？那么美国的试管婴儿的技术究竟有哪些比较有什么样的优势是优于中国的呢？
You know, for reasons that aren't clear, the pregnancy rates are the highest in the United States. They're about 33% higher than in Europe, for example. It's not clear exactly why, except that if you want to be a fertility specialist in this country, it actually takes 11 years of training before you can become a fertility specialist. So it takes a long time, and the training is very rigorous. And I also believe that the lab staff here and the lab environment is the best in the world. So we've had many patients that have failed 10, 12, 18 times before that we were able to get pregnant in their first cycle because of the protocols we use, because of the quality of the lab. So for whatever reason, success rates are higher here. One of the most common questions that I'm asked is about PGS. That stands for pre-implantation genetic screening. And so what that involves doing is testing embryos before they're placed in the uterus, before implantation. Because much of the genetic testing that's done with babies occurs after the pregnancy has occurred. And so if there's a problem, and at that stage, then you have to terminate the pregnancy. So it's very nice to be able to do it in advance and avoid that kind of situation, because it's such a tough thing to go through a miscarriage, and there are always risks involved when you have a miscarriage. In terms of PGS itself, I am a huge believer in PGS. But PGS has to be done right, and there are many, many different genetics laboratories that do PGS, and some are not very good at it. Others are outstanding at it. As an infertility patient, you must be able to believe that test result. If they tell you an embryo is abnormal, somehow you must know that they're right. If they tell you it's abnormal, you must know that it's right. And so I work with what I believe to be the very best genetics lab that there is. They have never given me a wrong result to this point. And even though nothing's perfect, it makes me very happy to know that when I give information to my patient, that information is accurate.
我能追问一个问题吗？为什么有些就是做完 PGS 的胚胎呢，在移植以后会生化？因为我知道有一些孕妇就是这个在移植完 PGS 的胚胎以后生化了，这个是为什么呢？
The amazing thing about PGS is that when you test an embryo and then you transfer it, you almost always get a pregnancy. It's absolutely amazing to me. And so we run 80-90% pregnancy rates. The only difficulties are when it's difficult to get the embryo into the correct location. But yes, sometimes there are miscarriages. Why is that? Well, it turns out that there are 20 to 25,000 genes in the nucleus of each embryo. It's not just the number of chromosomes, it's all of those individual genes. So if one of them has a problem, that would be a reason to miscarry. Sometimes there's a problem with the uterus and that causes miscarriage. So there are other reasons for miscarriage, but when you do PGS, the chance of miscarriage falls by 50%. So dramatically reduced risk of miscarriage, dramatically higher pregnancy rates. We do PGS on virtually every case we do. So the pregnancy rate is doubled and the miscarriage rate falls by 50%. And so I remember not that many years ago, even 10 years ago when we didn't do PGS, pregnancy rates were much lower. Yeah. It was a much harder thing to go through. Yeah. And women would have to do cycle after cycle after cycle to become pregnant. And it's so nice now to know that what you're putting in is a normal embryo. Because when you put a normal embryo into a normal uterus and you put it in there gently, it sticks virtually every time. Last year, we only had one negative test for any Chinese patient that had a transfer into her. Only one negative. It shows you how powerful it is to do PGS.
那我能再追问一个问题吗？就是您觉得是移植单胎好，还是移植双胎好？我知道很多就是国内的，他们都会就是这个移植双胎，那么他们都说移植双胎的成功率会很高，比这个单胎的移植成功率要高一些。对此您是怎么看的？
We almost never transfer more than one embryo. Probably 95% of the time or higher. Because there's no difference in pregnancy rate between putting in one and putting in two. They're the same. You have the same chance of becoming pregnant. So the only reason to ever transfer two is a couple that really wants twins. And we look very carefully at those patients and make as sure as we can possibly be that it's safe for them to carry twins. But things have changed. Single embryo transfer is the way to go because the pregnancy rates are the same and the risk to the woman carrying the pregnancy is much lower if they have one as opposed to two babies inside them. I think this is one of the greatest advances in the field of IVF. And PGS allows that, allows us to maintain high pregnancy rate by even though we only put in one embryo.
有很多的人他可能不太了解这个试管婴儿，他们会觉得这个试管婴儿生出来的这个孩子跟自然受孕的这个孩子，那么他的健康是不一样的。很多人大多数会认为，就自然怀孕的生出来的孩子可能要优于就是试管婴儿生出来的孩子。对此您是怎么看的？
I have looked at the research around the health of these babies for years, and I'm absolutely convinced that IVF babies are not as healthy. They're not. If you do a fresh transfer. So if you do your IVF cycle and you retrieve your eggs, and then a few days later you put the embryo back into your uterus, that's not a good thing. Some risks are higher if you do that. So we almost never do fresh transfers. We do all frozen transfers. And so we grow them out, we biopsy them, we freeze them, and then about 6 weeks later we put the embryo in. And the nice thing is, when you do it that way, the babies are actually healthier than they would be if you had not done IVF at all. So the key to avoid problems with IVF is not to do fresh transfers. Always do frozen transfers. The babies are larger and they're healthier.
那也有很多的女性会问，就是这个如果说是这个要打针催卵的话，会导致这个卵巢早衰，就会出现这样的问题吗？
You know, for many years we were worried about the long-term effects of doing IVF. And there were some studies many years ago that indicated a problem. But I think that answer has been solved now. There are now long-term studies in countries that follow every woman who has that procedure. And it follows them for 20 years, 30 years. And there appear to be no long-term effects of doing IVF. However, there are effects of being infertile, just simply being infertile. Even if you never have any treatment, there's an increased risk of breast cancer, increased risk of ovarian cancer, for example. And so anyone who's ever been infertile should definitely follow those things over time. Now, in terms of aging, I don't think so. In fact, when you do an IVF cycle, you actually retain some fluid. And so many women like what they look like. If they have wrinkles, they're filled in, and they think they look better. But there are some women that don't like the look. They think there's too much fluid there. But it resolves very quickly. So it definitely does not cause premature aging and seems to have no long-term effects on health.
您从一开始到现在已经有很多的这种成功的案例，那能不能给我们简单的介绍一下你们这些成功案例？印象最深的那一个，还有一个就是从最早的做成功的这个试管婴儿，现在已经有多少岁了？
I don't know how many IVF cases I've done. I've done thousands. And I remember many. One of my characteristics is I never forget a face. So when I meet someone, I never forget them. And I remember my patients. And I've had many touching moments over the years. I remember that in the second week that I was doing IVF, I helped this woman become pregnant with twins. And then she moved away, and I didn't see her for many years. And then one day, I was in my office, and two children appeared in front of me, and they held up their driver's license. It was 16 years later, and there they were. And it was so touching to me to see the profound impact that you can have on lives by doing infertility. And they were smiling, and they felt like we had this connection. And you have a connection with every child that you help make. Some other cases are women who try for so many years. I had this case of a couple that came from another country. And in the other country, they had tried everything. They tried getting pregnant together. They used an egg donor. They used a sperm donor. They used a surrogate. They tried everything, and nothing worked. But by working with them and understanding what the problems were, we were able to help them become pregnant in their first cycle. And they had twins. So there are many cases like that mean a lot to me, especially helping someone who has tried so hard for so long and who so desperately wants a child. To be able to help them is extremely rewarding.
那能不能给中国过来就是这个做试管婴儿的这些客户聊一聊？那比如说他要到了美国以后，他怎么来就是规避一些这种做试管婴儿的这种风险或者是陷阱什么的？
The most important thing for a Chinese couple to do is to work with a fertility specialist that understands them. And for years, people have said that people from China, Asian women and couples, they don't do well with IVF. I remember reading papers like that years ago. But what I've learned is that's not true. You simply have to treat them in a different way. You have to actually understand how their system works. And it doesn't work the same as the system of people that live in this country. And so once you understand that and you treat them according to the way that their body wants to be treated, they do very well. Very well. We have very high success rates. But if you try to use American methods with Chinese patients, they don't do well. It has to be adapted. And so what we do during a cycle is we understand where to start, and then when they come back, every time they come back, we analyze everything. We make whatever changes are necessary for them to continue to do well. And when you do that, then they do nicely. So the key is make sure that whoever you're working with is an expert at working with people like you. They're not just someone who treats infertility patients. They're someone that treats Chinese infertility patients and have a long history of doing well with them.
那最后一个问题就是针对这个中国的试管的客户到美国来做这个试管，有没有一些专业方面的这种就是建议或者是提示什么的？
If you're going to come to Gen 5 Fertility, we actually have someone work specifically with you to tell you everything that needs to be done before and during the cycle. These protocols work. And so if you follow those instructions, you'll do extremely well. And as I've mentioned, our Chinese intended mothers have done so well because they're so good at following directions. And they care so much that they do everything exactly right. And if you're prepared, and if you do exactly everything as according to the protocol, your chance of success is going to be extremely high. So I think it's very simple to work with Gen 5. We're available 24 hours a day for any questions, any problems that you have. What's difficult is trying to decide where to go if you can't come to Gen 5. If you want to, example, see a fertility specialist on the East Coast, it's very difficult to know who to see because you can't really believe the statistics that you read because the statistics are mainly based on the type of patient that the fertility center works with. And some fertility centers won't work with anyone who's not easy to become pregnant, or they work with only a few people that aren't easy to become pregnant. So when you hear their statistics, they don't really relate to you. So I agree, it's actually a very difficult problem. But fortunately, there are solutions. There are places that do specialize in Chinese couples, and they do well with them.
今天吴德医生解决了我们就是很多的这些疑问嘛，那非常感谢您那个吴德医生给我们中国的很多的家庭带去幸福，真的是非常谢谢。
Hi, this is Dr. Sam Wood from Gen 5 Fertility in San Diego, California. If you're looking to have a baby, we'd certainly be happy to take care of you. We love our Chinese patients very much. But wherever you decide to go, I hope that you're successful. It's an amazing thing to have the family that you want. I'm coming to China soon, and I'm looking forward to seeing the Great Wall and visiting Beijing and Shanghai again.